This is a very sad case, and I would extend my sympathy again to Mrs. Kemp, Emma's mother. Emma had a very aggressive form of cancer, and it was a very rare form of cancer, and I'm really glad to say that the Ombudsman's report has found and backed up the previous investigations that we've undertaken that showed that the care she did receive was appropriate. What the Ombudsman did find, which wasn't a surprise to us, was that our complaints process at the time, and we're talking nearly 5 years ago now, wasn't as good as we would have liked it to be, and we could perhaps have responded better to Mrs. Kemp's initial feedback, and we fully hold our hands up to that, and we've apologised to Mrs. Kemp, and we would do again, because I think we could have listened to some of her feedback and responded more appropriately, perhaps not used medical jargon and that sort of thing in our initial complaints response. And since then we've overhauled our complaints process, and we're trying to now concentrate on involving family and carers much sooner in the process, so that the local clinicians involved in the care can respond to complaints much more quickly. I'm glad to say that the report has backed up our findings, that there's no evidence that she wasn't cared for appropriately, but we're always constantly trying to do things better, and Emma was a patient with severe learning disabilities and with complex needs, and what we need to do is to try and respond to patients like Emma that are vulnerable in different ways, so that we can provide the highest sort of quality of care. And one of the things we have now is a specialist senior nurse who's aware of patients with learning disabilities, so that she can go along to the wards to talk to sort of frontline staff and help them think of different ways round meeting some of those more challenging aspects of care for people with specific needs. And that goes for vulnerable adults in general, not just people with learning disabilities.